All right, I think we'll go ahead and get started. Hi everyone. Thank you for attending this webinar today. I just want to start off by introducing the organizations responsible for developing the SRA tool and making it available to the public. The Office of the National Coordinator for Health IT, or ONC, is at the forefront of the administration's health IT efforts and is a resource to the entire health system to support the adoption of health information technology and the promotion of nationwide health information exchange to improve healthcare. The Office for Civil Rights, or OCR, enforces federal civil rights laws, conscience and religious freedom laws, HIPAA privacy, security, and breach notification rules, and the Patient Safety Act and Rule. My name is Ryan Callahan. Oh, sorry, advanced a little. It's in there. My name is Ryan Callahan, and I'm a project manager at Altarum, which helped develop the SRA tool. And I'll be leading this portion of the presentation. Nick Heasters and Ali Masihi are also key stakeholders on the project from OCR and ONC respectively, and will be available to help answer questions after the presentation. Altarum security risk expert Kathy Pisa is also available to help answer questions. If you have any questions during the presentation, please use the question feature in the GoToWebinar interface, and we'll read and answer questions during the Q&A portion of the webinar. The first part of our presentation today will cover some SRA tool basics. We know many individuals who attend these webinars have not used the SRA tool before or may have limited experience with it. So we want to give an overview of what the SRA tool is and how it works. We also want to cover some information for those of you who may be using the tool for a while. So we'll be talking about reviewing and updating an SRA. Then we'll go over a few new features in the latest version of the tool, and finally we'll have a Q&A. First, let's get an overview of the SRA tool and how to use it. Before I get started, there are a few terms I'd like to define, and I'll be using the terms SRA tool and SRA. SRA tool stands for Security Risk Assessment. So the SRA tool is the Security Risk Assessment tool. And then there's EPHI. EPHI stands for Electronic Protected Health Information. So when I say EPHI, I'm referring to a patient's protected health information. What is the SRA tool? So the HIPAA security rule requires healthcare providers, health plans, and business associates to conduct a risk analysis and implement technical, physical, and administrative safeguards to protect EPHI. The SRA tool is a desktop application designed to assist small to medium-sized organizations in meeting their responsibility to protect EPHI. The latest version of the tool was developed in 2018, and we've been supporting and making updates to it since then. The tool is composed of a self-paced questionnaire and a variety of reports for users to track their progress and assess their security posture. It aims to help covered entities and business associates identify and assess risks and vulnerabilities to the confidentiality, integrity, and availability of protected health information in their environment. The SRA tool may not address all risks that are known, and it may not be the only tool you need to conduct an accurate and thorough risk assessment. And any risks that are not addressed through the SRA tool must be documented elsewhere. So this list should give you an idea of how we developed the SRA tool and some of the documentation that we based it on. These listed standards, which include the HIPAA security rule, the High-Tech Act, the NIST cybersecurity framework, some special NIST publications, and even the health industry cybersecurity practices. These were all taken into account when developing the SRA tool's questions and content. Now let's talk about getting the tool installed on your computer and actually completing a security risk assessment. So Downloading and installing the SRA tool. I think there are a few basic things to understand here. The SRA tool can be downloaded from healthit.gov. This is the only place you can find the official SRA tool download. If you're interested in trying out the tool, we can distribute a link to healthit.gov here, or if you're searching for the SRA tool online, make sure you're looking for links to healthit.gov, which is the official website for ONC. The SRA tool desktop application can only be installed on Windows computers. So this means any modern computer running Windows 7, 8, 10, or 11 should work. And for users without access to Windows or who are otherwise unable to install the tool, we have an SRA Tool Excel Workbook that may be a good alternative. We'll talk about that a little later in the presentation. And this is also available to download on healthit.gov. So the SRA tool is an application that must be downloaded, installed, and run on your computer. Once you've downloaded the installer from healthit.gov, you'll need to open and run it. The installer should look something like the icon on the left when it's in your Downloads folder or on your desktop. Once you've run the installer, you'll have the option to launch the SRA tool right from the installer dialog, as you see there in the middle. And when the SRA tool has been successfully installed, a shortcut pictured here on the right will be placed on your desktop. This can be used to launch the SRA tool going forward. When you first launch the tool, you'll be presented with the welcome screen, which asks you to continue an SRA or start a new SRA. If this is your first time using the tool, or if you wish to start a brand new assessment, you'll want to select Start New SRA. If you select Continue SRA, the system will prompt you to locate and select an SRA file you've already started, and you can pick up where you left off. We'll cover Continue SRA later in the presentation, but for now, let's assume we're starting a new risk assessment. The tool will ask for your name. That's the first thing you'll be presented with, and we recommend entering your first and last name, or at least a first name and last initial. This information will be used to help keep track of the user who answered each question. If more than one person in your organization is going to be using the tool, they'll be able to enter their name as a new user when they open the SRA file you're working on together. So this login doesn't involve passwords or any credentials. It really just helps serve as an audit log. Next, you'll need to select a location to save your file. The SRA tool is designed to open and save SRA files. SRA files are saved using a proprietary file format that can only be opened with the SRA tool. And I think this is an important piece to understand for anyone using the tool for the first time. You create your SRA file with the tool, and you save it on your own machine or network. You need to file it away somewhere you're going to remember. And I want to note, nothing is saved or transmitted via the web. Everything you do in the tool stays on your own machine. If you need to work with your assessment outside of the tool, your results can be exported to Excel or PDF. Once you're logged in and have selected a save location, the first screen you'll see is this home screen, which contains some basic information about the tool. You also see the left navigation panel and the next button, which are going to be the primary means for navigating around your assessment. The navigation panel provides some quick access to different parts of the tool and contains buttons allowing you to save your file and to log out. Practice information. So you'll be asked to document your practice name and some basic contact information here. This information will be compiled into the reports that are generated once you've completed your assessment. You have the ability to enter multiple locations here if applicable, but this should be considered on a case-by-case basis. Sometimes it may be more appropriate to do a separate assessment for each location if your organization has multiple. If your organization is too large and complex for the questions to be meaningfully answered with a single response in a single assessment, you may want to look at doing 2 separate assessments, one for each location. If you find yourself answering questions that may be applicable to one location or another, I think that's a circumstance where you need to do a separate assessment. Practice assets. So this is an area of the tool that can be used to record IT assets at your organization. This is a relatively simple asset tracking tool, and if your organization is already using another system to track assets, it may be preferable to just continue using that and make reference to it along with your SRA. There are some features here that allow you to import assets by CSV or export assets from the tool, so you do have some ability to move assets into and out of the tool. In this section of the assessment, we're really trying to get the user to consider all IT assets in their organization. It means all your endpoints and network infrastructure, and keeping track of these things is an important part of maintaining strong security posture. So when we say assets, here's a closer look at the assets screen to kind of give you an idea of what we're talking about. The asset types that we're looking for are, laptops, desktops, tablets, medical devices, or really any other piece of equipment that comes in contact with protected health information. Got your asset status. So if you've got a piece of equipment, is it active or is it in storage? Or maybe it's no longer in use. So you might want to track whether it's been properly disposed of and when it was disposed of. We're looking for things like the encryption level, who uses the equipment, who it's assigned to, the physical location. And then you might have an asset tag or an asset ID. And then there's a notes field, which you can use to capture any additional details you might want about the asset. Next is practice vendors. This is a place for users to record some of their vendor relationships. So your risk surface doesn't stop with your internal IT environment. Your business associates, which are those vendors with access to your EPHI, can have insider access to highly sensitive information. And so your business relationship with them is a serious responsibility, and the tool provides tracking for these as well. The functionality of this screen is very similar to the asset screen. You can add vendors one by one, or you can use the CSV template. The table view at the bottom of the screen shows a listing of vendors once you've added them. And taking a closer look here at the Add and Edit Vendors screen, the sort of information we're capturing. It's some basic information about who your vendors or business associates are, what are the main points of contact, and whether you've assessed risks for this particular vendor. Next, we've got documents. The tool allows users to link to supporting documentation. These may be policies and procedures, certifications, agreements, or anything else that may be relevant to your risk assessment. You can link to documents elsewhere in the tool, and anything you link elsewhere will come to this document screen. So this really serves as a repository for any documents you've got linked to your security risk assessment. Now I've got the assessment section. So the assessment section of the tool is the real meat of the SRA tool's content. It contains 7 sections of multiple choice questions, along with a threat and vulnerability rating component, and then a summary for each section. Assessment screens are laid out with the question at the top and in the center. Your answer options are below, and then on the right, there are panes for education and references. The education pane provides guidance related to each response given. So the information presented in that education pane will change based on which option is selected here. And then you've got the references pane, which provides relevant citations to the HIPAA security rule, the NIST cybersecurity framework, and new to the tool this year, we've got references to health industry cybersecurity practices, otherwise known as HICA. After you've completed that multiple choice questionnaire portion of the assessment, you're going to see the threat and vulnerability rating screens. And you're asked to select from a list of vulnerabilities that may be applicable to your practice or organization. So that's here on the left. And then once you've selected those vulnerabilities, you're brought to a second screen where you see those vulnerabilities you selected, and then a list of threats that are related to those vulnerabilities. What you're asked to do here is rate those threats on the likelihood of those threats occurring at your practice or organization. So that's low, medium, or high. And then the impact that they would have on your organization should they occur, also low, medium, and high. So you'll need to fill these out to progress on to the next section. And once you've completed a full section of the multiple choice questions and the threats and vulnerabilities, you get to the section summary. Each section has one of these. The section summary shows a list of each of the multiple choice questions that you were presented, and then your selected response. And the questions here are divided into areas of success on the left and areas for review on the right. Areas of success indicate alignment with best practices, and areas for review indicate items that may need to be improved or revisited. And once you've completed all 7 sections, you'll get to the SRA Tool reports. So there are a variety of reports that become available once you've completed your assessment. The first one is the summary report, which I think is actually available as you're completing your assessment. But generally, you'll visit this after you've completed all 7 sections. This summary report shows a high-level summary of your assessment results. Important to note here is how your summary scores are calculated. Each section's score is shown in terms of risk percentage. So that's down here. And then you've got the risk score. The risk score is calculated % of the number of questions that fell into areas for review divided by the total number of questions presented. The other 2 scores seen here are total number of questions that fell into the areas for review. That's here. There were 26 in this example. And then a total number of vulnerabilities selected for your practice, which is 11 here. And then, like I mentioned down here at the bottom, you're kind of seeing this risk score repeated in terms of each section. So it kind of gives you a high level at a glance view of which areas you may need to do the most work in. Next, we have the flagged report. So you may have noticed when we reviewed the multiple choice portion, but each question has an option to flag this question for later. And so that might be if you don't know the answer right now, or you need to work with somebody else to get the answer, or for whatever reason, you need to skip this and come to it later. And each question that's marked as flagged this question for later will show up in the flagged report. So you can see here on screen, we've got a question from section 3, and that's question 16, and you can see that was flagged here. And so if you find that, you'll need to, if you want to make an actual selection for this question, you're going to need to go back into the assessment to get to this question and make that change. So that means using the left navigation panel to click the assessment item. You have to go back to section 3. You have to go to question 16, and then you make your selection from there. And once you've done that, that question should disappear from this report. Next is the risk report. The risk report focuses on areas of risk that are identified in your assessment. So these would be all of the areas for review, responses shown in section summaries, and other vulnerabilities selected as applicable to your organization. It also contains the education and references components to help guide you toward successful mitigation of known risks. There's some other visualization we do here, like calculating risk score based on your ratings and showing a breakdown of risk by risk score. In this report, if you see the export button up here, it's available to export to PDF. And finally, we've got the detailed report. So the detailed report is a collection of all data captured in your security risk assessment. This is the most complete report provided by the tool, and we really recommend saving a copy of this report each time you complete an assessment. And this report is available to export to both PDF and Excel. So yeah, we really encourage every time you complete an SRA, go ahead and export a detailed report. It'll just serve as the most complete record of everything that went into your assessment. So we've covered the workflow for users starting a brand new SRA, but what if you'd like to review and update an existing assessment instead of starting over completely from scratch? The SRA tool in its current iteration has been available for several years. At this point, we know most users interacting with it now have most likely completed an assessment in the past. So I want to take a few minutes to cover our recommended workflow for updating an already completed SRA. Completing a thorough and accurate risk assessment is an important part of protecting EPHI, and this should especially be considered when you're making updates to an existing assessment. So assessments can be reloaded from previous sessions to be reviewed and modified, but there are some things that users should keep in mind when using the SRA tool in this way. It may not make sense to update an SRA in all circumstances. Sometimes it may make more sense to start a brand new assessment. There are some things to consider before deciding whether you want to review and update an existing SRA or start a new one. First is the length of time since your last assessment with the SRA tool. If your security risk assessment hasn't been updated in a long time, if you've not started a new assessment in years, it's recommended that you start from the beginning with a brand new assessment. Second, if there have been substantial changes in your organization since your last SRA. So that could be substantial changes in IT infrastructure, maybe a change in your medical record system, a change in personnel, IT personnel or security officer, any acquisitions or mergers or anything like that, or maybe a significant relocation, things like that. These might clue you in that you should start a new SRA instead of modifying a previous one. And then finally, has the SRA tool been updated recently? Updates to the SRA tool's content, and when I say content, I mean that's the questions, the responses, the references, and education. Well, those will only be applied when you're starting a new assessment. Even if you're working from the latest version of the SRA tool, which is 3.3, if you're working on the same SRA file you've been using since 2020, you're not going to see any updates that have been made to the content or response options unless you start a new assessment. So that's always something to consider. Before modifying an existing security risk assessment, you may first want to create a new copy of your SRA file to work from. This can be accomplished using the Save As feature and saving an existing assessment under a new name. Save As can be found in the left navigation menu right next to Save and Log Out. This can also be done in your file browser using a simple copy and paste and rename operation, but starting with a new file ensures that work done previously will remain a historical record of the point in time when it was created. And just want to review, the example on screen here, if you were to right click on one of these and click copy and paste it in the same directory, write a new name with a new date, that's going to accomplish the same thing for you as Save As. I want to reiterate, so maintaining multiple SRA files, like we're showing here, ensures that you can go back and reference or print reports from an SRA at any point in time. So we really encourage this sort of workflow. Next, you'll need to open the new file you've created, or if you use Save As, you're already in the new file, so you can just go back to the beginning of the assessment using the left navigation menu. You click Assessment and you go to Section 1. Or maybe getting ahead of myself, the first place you should go is to the practice information. It's important to review the practice information sections like your asset and vendors list if there have been any changes to your IT equipment or vendor relationships. And assets, as we reviewed earlier, assets and vendors can both be added and deleted in those respective sections. So it's important to consider, when you're reviewing, go to practice info and see if there have been any changes in either of those two areas. In the assessment section, sections may be marked as complete, as signified by the check mark next to the section name here in the left menu. Selecting a completed section will take you to the section summary. So that's what we're looking at on screen here, the section summary for section 1. To properly review this section, you'll need to navigate back to the first question, which can be done using the back button. You just have to hit back a bunch of times until you get to question 1. Or there's this jump to section start button here at the top of the screen in each section summary. So if you press jump to section start, that'll just automatically take you back to the first question in the section. And that's what we've done here. You can see that we're in section 1, question 1. You may also notice that the check mark that was next to section 1 in the left navigation menu is gone. And that check mark won't reappear until all the questions in the section have been reviewed or answered. When reviewing a section, all your previous answers will be displayed, but it's important that you read through all questions and responses again completely to ensure that the assessment is as accurate as possible. So that means if you were to click next here, you're going to see the same answers that you had from last time, but you still need to go through, reread the question, make sure your response is still the most accurate response, and then proceed. And once you get to the end, that check mark will come back. On a note, if your responses to questions are changed, you may end up taking a different path through the SRA Tool's branching logic and be required to answer additional questions you may not have seen previously. And I want to make note of the details field that's available for each. Sorry about that. I want to make note of the details field that's available for each question. This feature may be especially useful when reviewing an assessment. Any details confirming your reevaluation of a question or explaining reasoning for changes to your response can be recorded here. And once you've reviewed and updated all responses to section 1, you'll need to do the same for sections 2 through 7. And when all sections have been reviewed, you can proceed to the SRA Tool reports. So just to review this update assessment workflow, there are a few things to keep in mind. First is to start from the beginning of each section, and you can use the jump to section start button to help make things a little easier, so you don't have to press the back button a bunch of times. Second is that it's important to read and reevaluate each question thoroughly. Make sure that the selected response is still the most accurate response for your organization. And also keep in mind that new question responses may result in new questions presented because of the SRA Tool's branching logic. And finally, really try to use that details field to record any changes and make notes to questions as you complete your review. So I've got a little slide on expectations here. Many users approach the SRA Tool not entirely sure what to expect, and that's understandable. We didn't cover everything you should expect in this presentation, but here are some tips that you can keep in mind. The first thing you should recognize is that you should expect to spend a significant amount of time completing your SRA, especially if you haven't done one before. And there are many resources freely available to provide guidance, some of which are called out inside the tool itself, but the process still requires an investment of time and effort. Second, in order to complete an accurate and thorough risk assessment, you should understand your IT environment, how it's used in daily operations, and what threats may be facing your organization. It's important to ensure that your scope of risk assessment is inclusive of all EPHI in your organization. Now I want to talk about some new enhancements for the tool this year. So some of you may know that we released a new version of the SRA tool, which is version 3.3. We released that on June 14th this year, and we're going to share a few enhancements or a few of the highlight enhancements that are available. The first enhancement I want to talk about is really, it's kind of a whole new way to use the SRA tool. In addition to the SRA Tool desktop application for Windows, we're now offering the SRA Tool Excel Workbook. The SRA Tool Excel Workbook is a set of interactive spreadsheets containing all of the questions and most of the content from the SRA Tool application for Windows. All 7 multiple choice sections are presented here, and the threats and vulnerabilities can be selected and rated, and the same education reference content found in the Windows application can be found here. So since we launched the tool, we've been receiving requests to provide a paper copy or PDF of the SRA tool's content, and we think this is a good way to provide that. We also think this spreadsheet will be a good way to provide access to the SRA tool's utility for users of Apple computers or users who are otherwise unable to install and use the Windows-based SRA tool. This version of the SRA tool is what we call platform agnostic, and as long as you have Microsoft Excel or something else capable of opening Excel files, you should be able to review and work with this assessment. We said these were interactive spreadsheets, so to give you an idea of what we mean when we say interactive, let's take a look at this example here. So maybe a little bit small, but the first you can see that question 1 is presented here, and it's has your practice completed a security risk assessment before? And there's a response indicator, this checkbox here, and it's checked next to the yes question response. And you can see that the guidance or the education and the references that are related to this response of yes are shown in these columns over here on the right. If you jump down, you'll see question 2 here. Do you review and update your SRA? And you'll see that the response indicator for no is selected here. And you'll notice that the whole row is highlighted in yellow. And this is really just to give visual indication that this may need further review. You can also see there's a risk indicated column and it says review here. But really we're trying to replicate some of the areas of success and areas for review utility as seen in the desktop application. And if something is highlighted here, that really kind of means that it's an area for review. Each section is presented in this way. You can see, if you can see the separate sheets down here at the bottom, each section is in its own sheet. So you've got section 1 through 7. Yeah, that's a good overview of the multiple choice part of the Excel workbook. And in addition to the multiple choice part, we also have the threats and vulnerability rating component in the Excel workbook. So in this example, you can see that I guess you can't see, these are drop-down boxes, the likelihood and impact. So you've got your vulnerability here and all of the related threats. Then you're asked to rate each of the related threats on their based on their likelihood and impact. These are drop-downs, and then we do a little calculation of the risk score here. So once you fill out these 2 items, you'll get a risk score with some colored conditional formatting to provide some better visual indication of risk. And there's threats and vulnerabilities for each section as well. So very similar to the desktop tool. So the next enhancement I want to share is the incorporation of HICCUP, or health industry cybersecurity practices, which is now included alongside each question in the SRA tool where it's applicable. We also made enhancements to the education and some of the other language in the tool to bring in some language from HICCUP. As I showed previously, this new content can be accessed in the SRA Tool reports and inside the SRA Tool Excel Workbook. So to take a little bit of a closer look on how we've incorporated HICCUP, if you look at the references pane, along with the references to HIPAA and the NIST cybersecurity framework, you can see that this question about IT asset management references HICCUP Technical Volume 1, Practice Number 5. And so when the user clicks on the reference element, a pop-up is displayed. And this pop-up gives an overview of what health industry cybersecurity practices is. And down at the bottom, you get a link to HICCUP Technical Volume 1. And so if you're going to follow that link, you'll get, it's sort of a PDF. But when you get to cybersecurity practice number 5, you can see that it deals with IT asset management. And it gives some more context about what sort of assets organizations should be considering. And you can see here, HICCUP says that it includes all endpoints, servers, and networking equipment. And it specifies that asset management practices should be built into daily IT operations. And we think that the inclusion of these references will be really helpful, as it gives some direction on best practices and some mitigation strategies we think might be more easily digestible than what can be found in the HIPAA security rule or the NIST cybersecurity framework. And it's more comprehensive than the education included inside the tool itself. Next, this is a small enhancement, but we hope it's a really helpful one. File association in Windows is something we didn't have before. SRA files are now associated with the SRA tool in Windows, which means that instead of having to open the tool and find your file from there, if you have your SRA top file stored somewhere, you know, here I've got it, this PC desktop SRA's risk assessments. If you just double click on one of these, it'll automatically open the tool and you'll be in your assessment. So hopefully that provides a little bit of an easier workflow for users working with their risk assessment. Finally, some more words on conducting a thorough risk assessment. We'd like to remind you that this tool is only to assist an organization with its review and documentation of risk, and therefore it is only as useful as the work that goes into performing and recording the risk assessment process. You might also say it's sort of a garbage in, garbage out philosophy. The HIPAA security rules risk analysis requirement specifies that organizations perform an accurate and thorough risk assessment of potential risks and vulnerabilities to all of the EPHI the organization creates, receives, maintains, or transmits. For example, if you're responding to questions regarding passwords and authentication, you need to consider authentication through all parts of the organization. It's not enough if you're talking about authentication to Windows or your Windows login. It's not enough to just consider Microsoft Active Directory password requirements, but organizations should also consider how authentication is managed in other areas, like authenticating to network infrastructure or tools and devices, authenticating to computer and application administrative accounts. Remote access has certainly become a lot more relevant now, and of course there are a lot more. The SRA tool may not address all risks relevant to your practice or organization, and use of the tool does not mean that your organization is compliant with the HIPAA security rule or other federal, state, or local laws and regulations. If risks are known but not addressed within the tool, they can and should be documented outside the tool. And that's all we have prepared for in the prepared portion of the presentation today. We do have some time for Q&A now, and I do have a few commonly, frequently asked questions that I'd like to get to. The first one is the just to help everybody know where to get more information about the SRA tool. So there are two main places that we publish updates. You can stay up to date with the tool. The first is the OCR listserv. There's a link here. I think we can distribute it in the chat as well. And if you've noticed, there's a handout available, which is the slide deck. And you can get the link there, as well as some other links that we've included in the slide deck. And the second are ONC email updates. So this blue box that you see at the bottom here, I think it's available on every page on healthit.gov if you just scroll to the bottom of the page. And you'll see this, and if you put your email address in here and click sign up, you'll be added to ONC's email updates. And if we have some news about the tool, you'll definitely see it there. And some other frequently asked questions while the panel collects some of the questions that have come in during the presentation. First one we get a lot is, will the SRA tool be made available for Mac OS or iOS? And the answer here is no. It is a frequent request and it could become a priority in the future. But you know, we did mention the SRA Tool Excel Workbook today, and I think that's a great place to start for users of Mac OS who don't have access to a Windows computer. Second one, does the SRA tool support saving to a network file share? And the answer is yes. And I like to remind users to think of the SRA tool and their SRA file like a Word document or an Excel file. So the SRA file is this portable file. You can email it, you can put it in SharePoint, you can put it in Google Drive, Dropbox, wherever you might store files. And as long as you have the SRA tool installed on your computer, you can open that file. So, you know, also one thing to keep in mind if you're putting this in a shared location, you know, multiple users can access the file from that location if it's on, say, a Windows file share, but the tool doesn't support like a concurrent access to the file, so only one person can be in there at once. But you know, I guess that's just something to keep in mind. Next, can I import an SRA from version 3, 3.1 into 3.3 and beyond? Answer here is yes. The SRA tool, since version 3, is designed so that all assessments are compatible with each other. So whichever version of the tool you have, if you have an assessment created with version 3 and beyond, you should be able to open it in whatever version of the tool. But something to keep in mind is that SRAs from version 2.0, and there's actually even an SRA tool version 1.0 that's, I think, a lot older, but neither of those will be able to be opened with the SRA tool version 3. And I think the last one we have here is, once an SRA is complete, can you record mitigations inside the tool? And we have some recommendations here. You know, of course, we talked about the documents feature. So documentation can be linked to your SRA tool in that way. And if you want to link mitigations that way, I think that's a good idea. There are also the notes fields that are present in each multiple choice section. And you know, the spreadsheet version, of course, you're pretty flexible with that. You can add columns or, you know, sort of modify that so that you can add information to it. Also, let's say you complete your assessment inside the tool and you want to export a detailed report or a risk report to Excel. I think that that'd be a great place to also record mitigations. So even though mitigations are not like an explicit part of the application, it is an important part of the risk assessment process. And you know, there are several ways that you can document them in a workflow using the SRA tool. So that's all I have for our sort of canned Q&A. I think we can have some time now. If the panel has received some questions, maybe we could go through and try to answer some questions from users today. We got about 15 minutes. and I'll go through too and look for questions.
Hi, this is Nick from OCR. So I do see a question in there regarding, well, it says, do business associate agreements satisfy risk assessment from a vendor? I mean, so if that means is a business associate agreement satisfactory for a business associates, a vendor, business associates obligation on the security rule to do risk analysis? The answer to that is no. The business associate has to do their own accurate and thorough risk analysis of their environment to ensure the protection of the EPHI that they create, receive, maintain, and transmit on behalf of their covered entity clients or higher level business associate clients in the event that there's a contractor-subcontractor relationship between business associates. As far as and I'm just reading this question in a couple different ways. As far as if it's asking, do we need anything, more than a business associate? Well, the rule or a business agreement. Well, the rule says that in order to share PHI, you need to obtain satisfactory assurances in the form of written agreement, a business associate agreement, and that we do talk a little bit more about this in our cloud computing guidance. The cloud computing guidance is drafted, through the lens of cloud service providers as business associates. But there's a lot of good information in there regarding general business associate relationships and business associate agreements and expectations. So I refer folks, if they haven't really, looked at the cloud guidance lately or haven't really looked at it through that lens, that it is a good resource for that. With respect to this question, there is a question that does talk about that or touch upon that, and that it does indicate that that the requirement is to obtain satisfactory written assurances from BAs before a community can share that information. But if based on their own risk analysis, risk management, or other compliance activities, covered entities, they may, if they feel they need to require additional assurances. So the rule requires written satisfactory assurances for one business associate agreement, but entities are free to seek additional assurances if their risk management activities indicate that may be a prudent way to go. And the cloud service guidance talks about different documentation where it may be appropriate to include additional assurances. It talks about including them in the BAA. It talks about including them in a service level agreement or other documentation. So I encourage folks to view the cloud computing guidance through that lens of overall community business associate relationships and business associate agreements for some additional information and guidance in these areas.
Okay, I've received a few questions as well that I think I can address. So let's see. Can we import our equipment inventory if it's in an Excel file from an outside source? I did sort of cover this a little bit in the presentation, but depending on what sort of if you're using an Excel file to track things, you can certainly convert that into a CSV and upload it into the tool if you want. If that Excel file was exported from some sort of inventory management system to begin with, and you're comfortable using that system, you might keep using that system, but certainly to keep everything in one place and sort of export from a system and attach that to the SRA tool, I think, yeah, if you can follow the template, there is a CSV upload template for assets. If you can follow that template and upload assets into the tool, I think that would be a good idea, and that's certainly possible. But you have to remember that you have to use CSV files. So if you have an Excel file, you need to save it as a CSV, and you'll need to make sure the columns are in the right place so that the SRA tool knows how to read the information. Let's see. Do you plan to make a web version available in the future? No, I mean that's a good suggestion. This is a desktop application that's on your computer right now, and we've sort of designed it that way so that nothing is transmitted via the web. I guess we could take that as a sort of a suggestion, but short answer, no, there aren't any plans currently to do a web version of the tool. Let's see. Somebody said that the guidance in the Excel file is different from the guidance in the OCR tool. Is this intended? So the guidance, all of the content between the desktop tool and the Excel workbook, if that's what you're talking about, should be identical. It should be the same. The same sort of content set feeds both of those different versions of the tool. Now, if you notice a difference, there could be a couple reasons. The first might be that maybe you're using an older version of the desktop tool, so that's something that I would check. Make sure if you're using the Excel workbook, check that you're using version 3.3 of the SRA tool, and you can find that out when you first open the tool. I think there's a check for version button or a link at the bottom right, if memory serves me right. And if you click that, it'll show you which version of the tool you're using, and I think it's actually in the shortcut too. So make sure you're using version 3.3. The second reason could be that you've detected some discrepancy or issue with the content. I mean, I know that I do think it's called education in the tool and guidance in the Excel workbook, so that's one difference. But if you're noticing large differences, please contact the help desk and we'll take a look at that. Because it should be the same. Let's see. I just lost one. I thought there was another one I had. Oh, wait. Okay, yeah, question about timestamps. So I conduct SRA for many small practices, and I start the user's concerned that updating won't change the date stamp for when a question was answered. I can speak to a little bit about how the timestamps work. So I mentioned that you log into the tool, and that provides sort of an audit tracking feature. The logged in user will be shown next to each question that was answered. And alongside that, there's a date and timestamp. So that date and timestamp is reflective of when the question was initially answered. So if you're completing a review and the answer to a question hasn't changed, then that timestamp is not going to change. Timestamp will only change if you actually make a change, make an update to the question response. So that's something to keep in mind. That each question is going to be tracked based on when it was first responded to. But I will say, if you've completed a review, if you have an older assessment and you're reviewing it, say you have one from last year and you're reviewing it again this year, I think if you save the file name with the new date on it, and some of your questions may be updated and may get that updated timestamp, I don't think that should be an issue. Just know that the timestamps there is reflective of when it was initially answered. And if you really want to change it, you can do that, but you kind of have to toggle your answer. You'd have to change your answer, go forward, and then go backwards and put your answer back to what it was originally. So you have to sort of submit an answer again in order to get the timestamp to update. A little explanation of how that works. We have about 4 minutes left here. Does anybody else on the panel, did we get any other questions anybody wants to try to answer?
Yeah, this is Kathy. I got a couple. One was, how often are you required to update your SRA? And I answered, you should conduct it at least annually, but if there's changes throughout the organization, like you have a breach, staff changes, EHR changes, then you should update your policies and procedures, and then take it a step further and you review them with the staff and document the staff has read the new policies, etc. So.
Yeah, hi, this is Nick from OCR. Just wanted to clarify that there's not a periodicity requirement for the risk analysis for the security rule. It has to, be reasonable and reflective of risks and threats, to EPHI and whatnot. So, but there is not a prescribed periodicity within the rule. Certainly, we have our guidance that's out there. The guidance supports a continual assessment to the extent that that's something that can happen of an organization to update documentation when new threats are understood, when new updates are introduced into the operations or environment of the system to make them part of a business process. But there's not a prescribed periodicity within the text itself, a regulation text for the risk analysis of the security rule. There may be other compliance requirements, MIPS, macro, things like that, that I'm not going to be able to speak to because that's not my area. But there may be other compliance requirements that may require a more strict periodicity.
Let's see. It looks like we got 2 more minutes here. I don't have anything else assigned to me at this point. I do want to make sure everybody knows that let's take some time to share some more resources where you can get help if you need it. So first of all, there's the you can contact us directly at the help desk with this contact information here, but also there's the you can submit questions via the Health IT feedback form on healthit.gov. So there's a link here. We may be able to distribute a link to that in the chat as well. But if you have these slides, you click this link. That'll send create a help desk ticket with the with us, and we'll respond, and you can give us feedback that way as well. I already shared the listservs, which are great places to keep up to date with information on the SRA tool. Also wanted to call out the ONC Twitter account. That's at ONC_HealthIT on Twitter. It's another good place to get updates about the tool. We've got some other information here. Remember, there's a user guide on the download page. That user guide does cover both the desktop application for Windows and the Excel workbook. So keep that in mind. And yeah, I think that's really it. Remember that the slides here were provided as a handout. So if you didn't get those, you can go ahead and pick those up. And I want to thank everybody for joining us today. If you have any questions, we'll try to respond to those who did, if you had an unanswered question, but certainly opening up a ticket from the Health IT feedback form or sending us an email here, that's a good way to get a hold of us as well. So thanks everybody for joining us today, and that concludes our presentation.